my name is Isabella Gozo, and today I'm going to be your student nurse today. So the first thing that I'm going to do is I'm going to be checking our patient and making sure that it's charted or ordered that we need to do wound care today. So I'm going to say, hello patient, how are you doing today? Are you in any pain? And I'm going to identify their name, birth date, check for the wristband. And in my answer, I'm going to close the curtain right here. That's important. And I'm going to raise up the bed and make sure it's up to a working height for me. If they're in any pain, I'm going to give them pain medication and wait 30 minutes before I continue on. I'm going to make sure I have my garbage can over here. And garbage can, bed is raised, and then we're going to wash our hands and do PPE. Put on the proper PPE if necessary. And then I'm going to put on my clean gloves now. And then I'm going to ask our patient also, I'm going to let them know what we're doing. So today we're going to be changing their wound care. So the first thing I'm going to do is I'm going to move this here and place our chuck here. Sorry. Alright. So we're going to be removing that with our push and pull method. Okay. And then we're going to be checking this for any we're going to see if there's any odor, colors, how much it's saturated or anything like that. Then we're going to dispose of this. Well, we have to reuse this. But so I normally just drop it like this into a garbage can, which our nurse one's right here. But we have to reuse this, so I'm just going to drop it here. And then we're going to also be looking here if there's any eschar, necrosis, any coloring, what stage the wound is in. And then we're going to measure it with our Q-tips right here. Am I loud enough? I think so. Okay. So here we're going to measure the length. Okay. So that looks like about 9 centimeters is the length. Right here. Okay. So that's about 3 centimeters, and then we're going to do the depth. So we have to take this out here and dispose of that also. Okay. So that's like 2.5 centimeters. So now we're all done with these. So we're going to dispose of them. Okay. Oh, I shouldn't drop my hands like that. I should keep above. Okay. Okay. So now we're going to dispose of these gloves also. So then after that, I'm going to begin setting up my sterile field over here. I'm going to wash my hands and put different gloves on just to keep everything sanitary. So I already put my tape out here, but after I put my gloves on, I take my tape out. Okay, so the first thing I'm going to do is I'm going to lay this drape here for our sterile field. I'm going to move this away. And I'm going to dispose of this. Oh, I'm supposed to dry. So I'm going to take this by the corners here. Okay. So then anything that touches like 2 inches around the border is no longer sterile anymore. So we're going to be opening this basin here. Here. Okay. And then I'm going to place this basin. Normally we tear this off, but since we're reusing it, we're just going to leave it on here and pretend it's not there. Put that right there. Okay. So then after that, I'm going to open up another Q-tip. Put this here. If it wants to come out. Okay, perfect. Right here. We're going to open up our abdominal pad. Okay. Great. So we're just going to discard this also. And open our little gauze here. Okay. So this we'd also rip this off and put this right here. Then we're going to open up, there's normally a wrap here, we're going to wrap that. Going to put some water, or our solution here. I'm going to put that back here. And then, like I said, I'm going to put my tape and I'm going to label on with the date, time, and my initials so they know when we did this. I'm just moving that so I don't fall or anything. Remove those. Then I'm going to open my gloves up. I'm just going to do some extra. Ooh, that's a lot. Okay. And I'm not supposed to turn my back to the patient after this, after I put everything on and set my sterile field up. Okay, so this is a coffin. There's me. And then I'm gonna open it here. Here. Okay, so then I'm gonna take my non-dominant hand and put my thumb up like this. Okay. And I'm gonna take like pinch it and put it here. Okay. Okay, now we're all set and ready to go. So the first thing I'm gonna do is I'm gonna take out this. And then I'm gonna take my water, make sure this is not capped. And then I'm gonna take my water here, or my solution. And then I'm gonna use my non-dominant hand, and this is the one that I'm gonna be holding my basin, and this now is no longer sterile. So I'm gonna clean it and clean it until it runs clear. And then after that, I'm just gonna put it here. So then I'm gonna dry it off with a piece of clean gauze to dry it off with my this hand. So we're gonna dry it. And then we'd apply any ointment or medication right now with our Q-tip if we need to do so. So then I'm gonna get one piece of gauze wet right here, and then I'm gonna hand this to my non-sterile hand so we can hold it on there. Sorry. Okay, now I gotta unfold it. Oh no, that would be dirty. Let's use a new one. Okay. Okay, this unrolled enough. So then I take this, my non-dominant, and put it in there. Pack it into the wound. Okay, then I take my other clean gauze, or my gauze, and then I cover it here, and then pack it on there with me. And make sure that doesn't touch. And then put my abdominal pad here. And then I should have removed this earlier, but now I'm gonna tape it. Oh no. Okay. Oh no. Okay. So then after that, I should have removed this earlier on before I put on the padding and removed it and just threw it away, but I have to use that. And now I'm gonna clean up here and then dispose of this. Use take that up, reposition, and probably you have to change the sheet. And then I'm gonna lower the bed. If it wants, I would lower the bed. I don't know where it's at. And I cover them back up. And then discarded my gloves. And now we're all done.